In this video, we're going to discuss Richard Palencia and his recent leg break at Bellator 286.
We'll be talking about the anatomy of the site affected, as well as some background about the fighter himself.
We'll finish off by discussing why this has been so common lately and how it can be prevented in the future.
Richard Palencia is a bantamweight fighter in Bellator MMA promotion who received the first professional defeat of his career by a TKO due to injury. Looking now at the fight in which the incident occurred, towards the start of the second round, Richard throws a low inside leg kick towards a medial part of his opponent's calf, which is checked by his opponent lifting his leg up.
After the shin-on-shin impact, it is clear to see the abnormal shape of Richard's leg. As the fighter steps back, the tension from weight bearing causes the final displacement to occur.
Richard was subsequently stretchered from the arena and is reported to undergo surgery the day following the fight.
Now, we'll have a little look at the anatomy. As you can see, the lower leg was affected. This consists of the tibia and the fibula. They both articulate at the knee joint and the ankle joint. In this case, both bones were affected.
Now, the most commonly affected part of the lower leg that's fractured is the shaft of the tibia, which may or may not be associated with a fracture in the fibula as well. Other notable fighters that also have had similar injuries are Anderson Silva, Conor McGregor and Chris Weidman. Now, it's important to think about why these fractures are occurring more in the modern MMA scene. And it makes sense when you see the number of leg kicks that are being thrown are increasing, particularly to the lower leg. Now, in order to defend against a lower leg kick, a fighter is required to check it, which involves them raising their leg with the shin directed towards the kick.
And the leg locked at 90 degrees, bring the knee up to the hand.
Now that causes shin-on-shin contact, and while the defender's leg is bent, that allows their knee joint to bend slightly, which helps to take some of the force off. Now, the attacker's leg is outstretched, which means that there's little room for their knee to bend, and as a result, there's less force dissipated, resulting in a tibia breaking.
So how can we look to prevent these leg breaks from occurring in the future? A method used by many combat sports athletes is something called shin conditioning. And this helps to prevent pain through damaging the nerves around the shin area. And this will consist of something like small trauma that's inflicted to the shin by doing things such as kicking a heavy bag or other hard objects. This works through something called Wolff's Law, and this increases the bone density due to microtrauma. There are examples of this in sports such as cricket and tennis where one limb is dominant over the other, and you can see in the examples put on the screen now.
Okay, so a possible management plan may include an initial reduction with imagery, usually an X-ray. It can be AP, lateral. You may also require surgery. Okay, of course, this may not be required, but if it is required, intramedullary nails may also be necessary.
And so that concludes our video talking about the case of Richard Palencia's leg break.
This has been GHU Medics.
And thank you for watching.
Action.
So today we'll be talking about